Hello everyone, I am your host, Ahad Hussain, and welcome to Season 5 of Titan Alumni Talks, a weekly podcast where we talk to alumni about their experiences at Cal State Fullerton. For this week's episode, we have Dr. Glenmore Hendricks, who is a nurse practitioner at the Riverside Medical Clinic, along with being the committee co-chairperson for health, policy, and practice for the California Association for Nurse Practitioners. He graduated in 2000 with a bachelor's in nursing science and received his doctorate of nursing practice in 2015. Listen as we talk about his experiences as a nurse practitioner, along with why he decided to pursue his doctorate. You can catch these episodes live at 10 p.m. on Wednesdays at titanradio.org, or you can watch all past episodes on our YouTube channel at youtube.com/CSUF alumni. You can also catch us on Spotify, Apple Podcasts, and Stitcher Radio. So thank you so much, Glenn, for joining us on the podcast today.
Thank you, Ahad. Good to be here.
First of all, start off with what you did at Cal State Fullerton, or actually your degree. So you started off in nursing science. So what kind of sparked that passion? And was Cal State Fullerton like the best option for you to get into nursing?
I'll take the first part of it. What spurred that passion? I'm from, a lot of my friends were pretty much medical and in nursing. And I think I actually started out, when I entered college, I wanted to do something in healthcare. And I started out doing the laboratory technology piece of it. And part of my job was in the hospital at the time was to go on the different units and draw blood. And I actually remember, while in doing that, I used to have a lot of conversation with patients. And I thought to myself, gee, I kind of love this interaction. I kind of love this relationship building that you do with healthcare. And so it caused me to change my major. And at the time, it was a logical step to go into nursing because as a nurse, you spend a lot of time with patients. You build relationship and you kind of, to me, it's the only profession that really allows you to touch people and their families and stuff like that. So it was really a logical step migrating into that. Now, the second part of it, why Fullerton? Fullerton was a convenience for me because when I started out in the nursing program at Fullerton, I was already a nurse. I had attended the junior college and earned an AA degree. And so when I went to Fullerton, it was very convenient because I had to go to school just one day a week. And, so I was able to work full time in the process and still able to, maintain my lifestyle at the time. So Fullerton really was it was a logical choice and I never regretted it.
So you mentioned that you were already a nurse since you received your associate's degree. So what kind of made you come to Fullerton to decide to get your bachelor's if you were already a nurse? Did you feel that pursuing your education further was a benefit? Or is the field that you're in something that you can do with just an associate and becoming a nurse that way?
Oh, that's a very important question. Yes, I wanted to, I think I was a nurse for at least 4 years. And, started out in just general medical surgical, where you take care of just about everyone. And I, as a nurse, advanced into critical care. And at some point I had a passion to do more, to advance, so I needed to advance my degree. I think at the time I wanted to do management. So I actually decided, this is the pathway to go as an with an associate here just starting out. And I just wanted to seek some advancement. And at that time I wanted to do management. I think that's why I actually went back and do the bachelor's.
I see. So sort of pursuing your education was something that isn't necessary, but it's kind of something that you can do. And I guess for students who are trying to get into the field, it's something that is optional, right?
Well, it is something that is optional and probably something that is necessary. The last thing you want to do when you get into a career is to get stuck in a hamster wheel, so to speak. And the only way to move out of that sort of situation is to advance yourself. If you do have the ambition, you do have certain goals that you want to achieve. So it was, yes, I could have stayed there at that level, but and nothing is wrong with it at all. It didn't take me away from nursing, but I learned to do what I'm doing much better, if you understand what I'm saying. Because I was able to process more with that, advanced knowledge, so to speak. So I benefited from the from that advanced degree. My patients benefited because then I know a lot more of what I was doing and why I was doing it. That was the whole reason for doing that.
I see. And then you ended up getting your master's soon after you got your bachelor's, almost right after. So what kind of made that transition as well? Because you took that gap in between getting your associates and your bachelor's, and then right away you got your bachelor's and then your master's. So you kind of went from like one class a day or like 1 day a week you were going to school, and now you spent like 3-4 years getting your master's. So it seemed like something sparked and you decided, let me go all out, just started going all out in school.
Yeah. One, I got bored, and two, I had such a great time. You know what? The Fullerton program was really the one that sparked me to move forward. It was so, I thought, at the time, very enriching. And when I did the basic nursing school program, it was horrible. It was a horrible experience. It was hard work. The stuff was new. It was like learning a new language. It was very frustrating. And here it is. I went to Fullerton. They taught me how to research. They taught me how to write. They taught me the passion of nursing, so to speak. So when I got there and I got the bachelor's, I think it was a good time. I had great classmates. We had really, it was from there. A lot of them were from various backgrounds. And so, we shared a lot in class. We developed academically, and for those couple of years that we were there. And for me, it was, at the end of it, I thought, gosh, this wasn't enough. And one of the other things that actually propelled me in the direction of the master's degree that quickly, I wanted to transfer that's a nice thing about nursing, you can do anything with it. I wanted to transfer from the hospital setting to the ambulatory setting. And not only did I want to do that, I wanted an advanced degree. I wanted to be a provider, clinician, independent, so to speak, in the ambulatory setting. So that's why I went back to do my master's, and I landed up at actually Cal State LA. And that's where I got trained as a primary care nurse practitioner. Having that advanced degree, having that advanced training, I was able to pretty much transition into the outpatient world, actually managing disease process. The other thing, though, while as a baccalaureate nurse, I worked in critical care and trauma critical care. And in critical care, you see the worst of the worst. You see diabetes that's very uncontrolled, and they ended up, in very complicated state. And so I remember working the night shift one night and thought to myself, if I do an advanced practice, pursue an advanced practice pathway, I want it to be to prevent patients from getting to this state. So if I can actually teach them how to manage their disease process, then I could prevent a lot of this. So that what really drove me even more into the outpatient setting.
So you brought up a lot of great points, and the first thing I want to touch on is that Cal State Fullerton does spark that interest, and they do take a lot of time in their students that it kind of makes students realize their full potential, like they did in you, where you did realize that you did want to continue your education and continue studying. And I have a ton of friends, and me personally as well. Fullerton, it kind of just does that to you. Kind of just make sure that you get to that full potential, and you don't sell yourself short, because we got to make sure that, hey, not everyone's able to become like the president of the United States, but we can at least try our best to do, or at least exceed in the field that we want to exceed in.
Right. And I want to tell you, the faculty, especially in School of Nursing, those were the most distinguished and dedicated group of people that, in my academic life that I've actually encountered. So, they want you to succeed. They put you on the right path to do it. They nurture you in such a way that that you'll be able to achieve your full potential. So, I have just the utmost respect for, the faculty at Fullerton. And so much so that when I wanted the terminal degree, which is a doctorate, which I received in 2015, I thought the best place to end it all was Fullerton. And I haven't regretted it, because it's like they pushed me to another level, to a place where you and I can have this conversation.
And then another great point that you brought up was in regards to working with outpatient and owning your own practice. So with it, you would need a master's degree, right, to focus on that. So I guess this is like to anyone who does want to go down that road in the future, then you got to keep your mind open to getting that master's degree, as it is necessary to do that. And you also mentioned that you were focused on diabetes and working with those patients. So it reminds me similar to law or being a physician, where you do get to focus on those individual aspects. And it's not just as a whole of like just nursing. It's you can focus on those issues that maybe are more prevalent to you, or what you see, or just what you want to fix, which I find kind of interesting. It's not just you get in the field and it's just the field. It's a lot more than that.
It's passion, yeah.
Mm-hmm. Yeah, you can actually find, like you said, that passion for it. So you mentioned that and then the faculty, right, that you brought up. I interviewed another nursing student who ended up working in the faculty at Cal State Fullerton, Austin Nation, and he said the exact same thing. The faculty was fantastic in the nursing program, and now he's a part of it because he just felt that it was so great that, and who knows, maybe one day you'll join as well. Who knows, become like an adjunct teacher, or maybe even a full-time professor over here.
Maybe one of these days I'll join them. I wouldn't. I wouldn't turn down the opportunity to do it at all. It's great people.
Mm-hmm. So another question I had is, what's the difference between pursuing the path of a doctor and pursuing the path of a nurse? How does one decide which way to go? If I know for a fact I want to go into healthcare, so do you think you can put some insight into that?
Well, yeah, it's vastly different. The medical model is different from the nursing model, for one. And, for a nurse practitioner, you're a nurse first. That's a different pathway. Whether you start out at a 2-year college versus a 4-year college, it's just a total different pathway in teaching. And also, for the medical side of it, it's just, doing that pre-med pathway that leads to, med school exam, whatever, MCAT or whatever it is, exam that goes directly into medical school. So it's really different pathways. In our world, we talk about the medical model versus the nursing model. And I think, as nursing developed over the years, they just kind of pursue different pathways. I ended up as a nurse practitioner on the nursing pathway with an advanced degree, with advanced training. So my training as a nurse practitioner in primary care was really very focused. I didn't do a lot of the medical sciences, subject coursework that actually, would lead me into being a physician.
I see. So it's kind of sort of where your passion lies before going into that.
Mm-hmm.
I guess like if you are a student trying to get into the medical field, you should kind of do some research to see which one sort of suits you better. Because I believe like becoming a physician is a lot more hours. I have a few friends who are trying to get into that, and it just seems like their schooling will never stop. They kind of don't have an option. Whereas nursing, I feel like it's a little bit more optional and a little bit more free flowing, where you can choose to get those degrees, but it's not as necessary as it is to become a physician.
You don't have to, right? Mm-hmm. You really don't have to. So, but having said that, though, when I wouldn't really underestimate the nurse, the pathway of the nurse. Medical care, it's about experience. And as a nurse, you kind of get that experience really very early versus, a physician getting out of medical school. His first day looks very different from the nurse who is actually there. His first day will look very different from a nurse's first day. But, you get the exposure very, very early. You can actually cross over. I don't know a lot, but I've known nurse practitioners who've actually gone to medical school after they completed master's and everything. They just do the extra coursework. The bottom line is, when you look at healthcare, not only not only in the US or even around the world, healthcare is really about it's more of a collaborative effort, where you have every single discipline having an important role to play in the care of the patients. So it's not just, it's not just a physician who owns a patient. The nurses do, the physical therapists do. It just depends on the contact at the time. So it's really for someone who's looking into healthcare, it's a matter of where, what is your passion? Where do you see yourself in the next 5 years and 10 years at the end of all of this? It doesn't really end, because when you get into healthcare like this, there's always something to learn. There's always something new. So you have to have this commitment to lifelong learning. Some people just want to get out of school and go get a job and earn some money and be done with it, and pay the mortgage. But when in healthcare, whether physician, whether nurses, nurse practitioners, it's a commitment to lifelong learning. And a good example of that is what came out of COVID. We didn't know anything about COVID. We know a lot more today in October.
And talking about that and the time it does take, because I feel like a lot of people get into the notion when they're getting out of high school, they think, if I want to go in the healthcare field, then I'm going to be stuck in school for the next 8 to 10 years. Mm-hmm. And with it, like some people, they do have to make money. They do have to support their families, and mm-hmm. they cannot afford to spend all that time and all that money to do it. So I guess nursing is a good alternative where you do get to work with patients, and you do still have the opportunity later on if you feel becoming a physician is a possibility, but you don't have to make that commitment right there and then. And instead, you can get an associate's or get a bachelor's or just get a master's. And it's still a lot of work, no doubt, but I guess it's like an easier pathway into healthcare. And I guess it just depends on what suits each individual person. Some people might be able to afford taking the time, spending the money, and putting in the dedication to becoming a doctor. And if so, that's a great path. But if any of those don't work out and you still want to be in healthcare, nursing seems a fantastic alternative where you still get to work with patients and kind of have a little bit more leniency with it.
Well, and I mean, I don't want to kind of put it off and say it's an easier route, because really it's not. You still have to put in that knowledge. You still have to build on that knowledge. So you still study. I remember doing all those all-night studies just to
Yeah.
to pass that critical care course or something like that. So there's still a lot of brain power that goes into it. Doesn't go into the depth of medicine, but like I said, it's a different pathway. And nursing science over the years, I've actually done pretty well. It's developed pretty well, and one of the main things that we've been able to do, especially in nursing, is to publish on what you do. And when you publish, you share, and you develop and you grow. And that's how you actually grow a profession. So medicine has it real good because they publish all over the place. Nursing, we do, but we've only been able to do that when more people do it, and and make a real career out of it. And in the whole process, you're able to share this or become better at what you do in taking care of the patients. In terms of developing that quality work, you actually get better at it.
Yeah, like the thing is, I can't personally imagine working those like long nights and memorizing everything that it comes to it. I'm more of a, I don't know. I think of my memory is very bad, so I can't imagine looking at a textbook and trying to remember everything before an exam and
Yeah.
spending those long nights. It wouldn't work for me. Um,
Right.
so you so you did go and get your doctorate almost 10 years after you got your master's. So
Yes.
you told me that your experience in the beginning of Cal State Fullerton, the first time you got there, it was that 1 day a week going there. So I don't assume there was much of a connection to the campus. But how was it during your doctorate program? Were you taking more time on campus, or was it still sort of spread out?
That it was still like that the first year, especially. And like I still went back there because yeah, we'd meet there every Friday. And that was perfect. I could still maintain a lifestyle and pay the mortgage, work full time. But yes, the convenience was there. And that's what part of why one of the other reasons other than it's a great faculty is if you want to end, if you want a terminal degree or anywhere in your path, I mean, Fullerton is just the place to be as far as I'm concerned.
So why did you decide to get that terminal degree, and like what kind of sparked that? Because like you said, you were able to open up, like with a master's degree, you're able to work outpatient, you're able to open up your own
Mhm.
clinic. So what does the title of a doctor sort of add? Like I understand continuing your education is great, but was there anything that was like the tipping point where, hey, now that you have the title of doctor, are you able to do anything new, or what kind of changed with it?
What made me decide on doing it, like, yeah, 10 years later, there was a report that came out. It's a Future of Medicine 2010. And it talked about, in order for us to, even as nurse practitioners, um, if we want certain things, if we want things like independence, if we want, pretty much to be out there, we need to pursue a degree that's terminal. Like for instance, like the physicians, the pharmacists, even if you're an attorney. Um, but if we want to actually perform at a higher level, the best way to go, that was the recommendation out of the Future of Nursing document 2020. Um, that's where we need to go. That's the direction. And I took that really seriously. I really did. I also, part of it is, it also goes back to the patient. Realizing that primary care, which which I'm still involved with, the care can be so fragmented for patients. You call, you can't get an appointment with your doctor, you can't get an appointment with your dietitian, and it's, or you see a different person, the dietitian is different, and the care that you get, it could be from different places and so on. And then you find that nobody is actually talking to each other. That's what fragmentation needs to be. There was a document that I read, regarding something called a medical home model, where the care is focused on the patients, and it's a collaborative care with different disciplines that actually has some sort of responsibility in the healthcare process for that patient. So I wanted to, and the only way I could actually transition into something like that at the time, I need to understand it. I need to know more about the background and the research behind it. I need to know the effectiveness and how to actually, is it good for chronic disease management? And so the doctorate actually gave me that pathway to develop, that research and understanding. That was my focus during the doctoral program. Essentially, the doctoral program was going to focus on, a model of care to improve primary care practice. There were a lot of people who were doing it anyways, but that was my focus. That's part of what I, really decided to go into the doctorate about. For it yielded some unintentional benefits in that I was able to publish the work that I did, which I've never even thought. I remember the first day of the doctoral program, we were all so nervous, nobody talked to each other, because it's like, how are you going to really get through the next 2-3 years? And you want to do it in 2. With all the stuff the volume of work that's before you. So it was very nerve-wracking. But gosh, the excellence of the faculty at Fullerton, they just kind of came through and said, gosh, it's okay. It will be okay. And this is, we will show you how, and point you in the direction which you should go, and we will help you to develop and support you. So, and that's really what you want to hear in any kind of academic setting. So with that, I was able to publish. I started lecturing. I delivered. I presented at conferences around the world, as far as Saudi Arabia. So, and I don't know that I would have been able to do any of this stuff, even at a master's level, because I really didn't have that maturity in terms of academic and confidence as well.
I see. So again, this is something that is optional, but like you mentioned prior, expanding your knowledge and making sure you are exceeding in the field that you are, and just because nursing is still like an evolving field. It's not like you go to school once and you learn everything, especially because you went to, starting off, right? You started off at SBVC, I guess almost 20 years. Yeah, you finished like 20 years prior. You
don't remind me, please. Back then I was the youngest person in my class.
But there's probably like so many things that have changed in like the field of medicine that you kind of need to go back to school or work on your own and figure out what you have been missing out on. But you also mentioned like the home health care Again, on the previous podcast episode that I did with Austin Nation, he did mention that exact same thing. So it
Yeah.
feels like a lot of people have this similar experience when it comes to nursing, and
Mhm.
just seeing what happens with it. So yeah, let's talk about a little bit about what you do currently. So what does like a day in the life look like for a nurse practitioner? Just start off at where you work, Riverside Medical Clinic.
So at Riverside Medical Clinic, we are an outpatient-based clinic. It's a multidisciplinary clinic. When I say multidisciplinary, it offers, I would say, I shouldn't say multidisciplinary. It's a multi-specialty clinic, and it's probably one of the largest in California, if not the largest, because it offers cardiology, internal medicine, pulmonary, everything that you could think of under one roof. My day in internal medicine generally starts at 8:30 in the morning, and it's a lot of you get to see a wide variety of patients. You get to see, when I say a wide variety, my age group is from 17 to 100. I had a patient who was 100 years old. And so you get to see a lot of stuff in that pool, a lot of, illnesses in that full day. It could be someone, it could be, a young kid coming in who had his first STD, or, someone who is struggling with depression, or someone who's struggling with, some other chronic illness, their diabetes or their asthma. And I feel that even in, those are you're treating the illnesses as they present themselves. But a lot of my day involves teaching. How do you manage this? How do you, reinforce it and teach it? How do you manage this back pain that's been going on for 5 years? Or, and so I write, yes, prescriptions. I fill prescriptions. I start treatment processes. I manage treatment processes. But it really involves a lot of teaching. And that's where the knowledge base really, really comes in and presents himself, because patients are presenting before you and they're looking to you as the expert. And so, it's doing that teaching, that feedback, that follow-up. The other part of my job is also responding to emails, because this is a very technologically driven society, and we have a medical record system where patients pretty much have 24/7 access to us. So is responding to emails, is troubleshooting even, little incidents that comes up. It's talking to the pharmacy. It's interacting with the staff, and there's the team that supports me. So really, that's typically my day from the moment I walk in to when I leave. And sometimes it goes longer.
It is kind of like a full day, and I guess something sort of new every single day, depending on the patients that come in. It's not like your typical office job, just filing paperwork tomorrow, file the same paperwork. But
Right.
it's you're working with people. It's a collaborative effort, like you mentioned. Like the word you used, I think multi-specialty. So with it, I guess like you're working with other physicians, other nurses, and just a ton of other people in the clinic, which is quite interesting that you guys are all working together to solve, I guess, like one issue, right? People's health.
Right. Exactly. And I mean, it could be too, when someone you first diagnosed them with breast cancer, or they have an X-ray and you realize they also have a lesion on the lungs. So you actually, which turned out to be cancerous. So, that's a whole process. When you see someone say, I can't have this, I'm just about ready to retire and enjoy my life. What do you mean? And I have to start chemotherapy for however how long, I'm going to lose my hair. What am I going to tell my teenager? Stuff like that. So the day really, it's a full day, as you said, Ed, and it's really very interactive. And you're really pulling on that team to actually help you to manage situations and patients.
I see. And that's just part of the work that you do. You also recently started on the Health Policy and Practice Committee, and you were a co-chair for that. So what sort of is that? Can you describe what the job is there, and why did you decide to go into this? I guess like quite a few years after you finished all your education, you had a good job. What kind of sparked you to also join this?
Because I get bored. Like I haven't done enough. But you know, I've always been involved in the Nurse Practitioners Association since my days as a and as a student at LA. That's one of the things that I was actually. We were actually, as students, encouraged to join our association, as all the doctors have their associations. And it becomes more and more relevant. You have to understand that in the nurse practitioner world, we don't always get what we want or have the freedom that we would like and with the rest of our colleagues around the country to be involved in the care that we do. And why do I say that? There's a political and advocacy role that is involved with being in this position, with being a nurse practitioner. And it's one thing when you're here taking care of patients, but then there's another piece of it out there where you want to make sure that legislators in Sacramento understands what you're doing. And so if they pass a certain bill that may actually suppress what you're doing or create more barriers to what you're doing because they don't know your field. And so that's how you actually get involved from advocacy. You become an advocate. So essentially, I'm an advocate. I've always been a part of my professional association, served on the board in various capacity. In the Inland Empire, I was also the president of the Inland Empire Nurse Practitioners Association. This is my first time serving on the board from the state and in an area that's health policy and practice. Why? It's my passion. And what we do in this group is look at all the legislations that comes out every year around January to March, and pretty much look at the ones that impacts our practice, supports our practice, or put our practice in danger, and we start talking to our legislators. So it's a very interactive role from that political standpoint. A lot of people really don't have the nerve for it, but it's really an important role to play. I am now, yes, I recently started 12 days into it, the health policy co-chair. And pretty much my term is for 2 years. For the next 2 years, we'll be looking at the legislative process over the next 2 years to ensure that the gains that we make as nurse practitioners from a legislative standpoint, we maintain them. The gaps that we have in that's preventing us from care, we try to work to improve them. And for instance, there was a bill or a law that just got signed by the governor over a year ago, about a year ago, pretty much. That started really to take effect as of January, but that has to do with our practice as nurse practitioners, independent versus not independent, not very independent, in layman's term. And we're working our way through that bill now that is becoming law. We had to give our input as they, develop the regulations surrounding our practice. So really the role of the health policy chair is to help to protect the practice of nurse practitioners in the state of California. And it's a big role. I'm excited about it, because it's just, I don't know, it's just my thing. I want to prevent myself from getting bored, I guess. But it's a very good role, humbling role to be part of, actually.
I see. So it also thinks about like the bigger picture. It's not just who you're helping in your clinic, but it's also how people all over California, and I guess it can extend all over to US as well, working on this and just making sure that the best practice is for the patients and it's not kind of tied up with lobbyists and politicians. And they actually are, listening to people who are dealing with patients who do have that firsthand experience.
Exactly.
And we're going to ask him some of these quick fire questions that we do every episode, so you guys know how it goes, and Glenn, you're about to experience them. So the first part is coffee versus tea.
Tea.
Tea. Which type of tea do you like?
Mint.
Mint tea? Oh, that's pretty interesting.
Yes.
So what was better, your undergrad, your postgrad, and then your doctorate? So which one was your best experience?
My undergrad.
Your undergrad, okay.
Yes.
Do you prefer dogs or cats?
Dogs. No, cats.
Dogs. Oh, cat. Oh, okay. You're little. What was the last song you listened to?
It was a song by Sean Paul, Temperature.
All right, and the last question is, now that we're getting into the winter season, winter or summer?
Summer.
So now we just have a few last questions. So let us know, like, what advice do you have for students who, let's just start off with students who are going into nursing. Let's say they're starting off at Cal State Fullerton and they want to get into nursing.
Make sure you're passionate about what you're getting into and why you want to do it. Spend some time in the profession with someone, volunteer somewhere. Volunteer in that environment. Because the last thing you want to know is getting into school and halfway into it, you realize this is really not for you. And healthcare is very broad. So I would recommend learning the basics, doing the broad stuff, and then narrow. Focus on one discipline. But be generalist first before you decide to focus.
I see. And then what about for just students in general who are going through, everything going on in the pandemic, everything with school, like, partially being online, partially in person. So do you have any advice for students?
Keep going. And there are obstacles that will come your way. But really be determined, never really give up on anything. Don't be afraid to fail. They're not really failures, they're mere stumbling blocks. It's just, you just keep your eyes focused on the goal where you want to, the goal which you want to achieve.
Mm-hmm. And my last question is what does the idea of success mean to you?
I'm successful if I get results, if I take care of you and you are better. Then to me, that's success. It's not about a car and a house and, able to send a kid to college, to wherever. But for me, it's how I define success is really I'm able to make someone see a better part of themselves and do better for themselves. That's success.
I see. So those are great bits of advice, and we really appreciate sharing with us like what it is to be a nurse practitioner, what it is to, because you did have a unique path, especially with your schooling, taking those gaps like intermediary and coming back and, getting the highest degree that there is, getting your doctorate degree. So I'm sure a ton of students, and I have definitely learned quite a bit about this. And one last thing that I want to invite you on and invite any students who are not on this yet is our Titan Pro network. It is basically our very own site that is similar to LinkedIn in that you can connect with alumni, students, faculty, and staff. And it's exclusively for Cal State Fullerton, like I mentioned prior, students, staff, alumni, and faculty. So it kind of builds that rapport and makes it a little easier to connect with people, since you know that two people have the same background. They at least share something in common, instead of just reaching out to people blindly and cold calling them. So Dr. Glenn, if it's something that you would like to get on, then I'm sure a lot of students will have questions and would like to talk to you about this on it. So again, Titan Pro Network, it's super easy to sign up, and with it, stay connected.
I believe I'm on it already.
Oh, you already get students that message you on it.
Exactly.
Mm-hmm. So yeah, that's perfect. And then more students can sign up, talk to you on there, because it's very simple to ask someone about their background, ask them how they got here, and ask for any advice. So thank you again, Dr. Glenn, for joining us on the podcast today.
You're doing a great job. Thank you so much.